In Module 8, you will learn when and how to talk about treatment with your loved one. You'll also learn about the different types of substance abuse treatment and how to present it to your loved one.
You may be quick to tell me that your loved one's been to treatment and it didn't work. This is important, so please listen carefully. Treatment is the best answer we have for a substance problem. People who try to quit smoking try on average 7 times before succeeding. Quitting drugs or alcohol is also a process and may take several treatment episodes before there's any traction. Don't give up on treatment. A little further on in this module, I talk about the specifics of treatment and what you can do to help make it a success. 2 things need to happen to stop using drugs and alcohol. 1, there needs to be a moment of willingness, not 100% willingness necessarily, but some willingness on the part of your loved one to listen and to consider recovery. And 2, the message of recovery needs to be in front of your loved one at the moment they are willing. Treatment will provide that message. So willingness and the recovery message need to line up. In this module, we teach you how to notice moments of willingness and how to respond with some carefully chosen words and treatment options at the ready. So how do you get your loved one to go into treatment? Well, it's everything we've been talking about. You create that bridge between the two of you. You empathize and show respect. You stop the negative talk. You add in positive talk and listen to what your loved one is saying. You make requests. You don't dominate. You take care of yourself, which helps you stay calm and patient. And you understand that getting sober and clean is a process. Doing even only a few of these things to the best of your ability will help your loved one open up to you, to be more likely to say when it hurts and to ask for help. By following the strategies laid out in these segments, you've set the stage for your loved one to come towards you and to talk to you. To this, we add 2 more strategies. 1, looking for a wish or a dip, what we call change talk, and 2, having a planned conversation about treatment. It may be hard for you to imagine, but there are moments in your loved one's life when they want to change. You may not be aware of it. Perhaps it happens at 3 in the morning when your loved one wakes up from passing out and can't get back to sleep because of the alcohol still coursing through their veins. Things look bleak. In those moments, they clearly see how the alcohol or drug is to blame. Maybe they even see the need for help. Their willingness to examine their use is brief and fleeting, but it does happen. By now, you've improved how you communicate with your loved one, and they are more willing to talk with you. You're doing everything to allow your loved one to open up to you and to share that moment they just had in the middle of the night. It'll come out as a wish or a dip. If it's a wish, you'll hear talk about the need to improve their life, such as a comment about getting healthy, joining a gym, or a desire for something that is currently out of reach, like school or a driver's license, a vacation. Or perhaps it's a dip. Something dampens their outlook. Perhaps something happened to your loved one that caused them embarrassment or shame. Maybe the boss smelled alcohol and said something. Perhaps the talk is about feeling sad or anxious. This is what we call change talk. This is your loved one's own motivation for change poking through. Be on the lookout for change talk, a wish or a dip, and respond using the communication skills and reflective listening we went over in Module 4. So for instance, your boss smelled alcohol on you. It makes sense that you're embarrassed by it. I know you've been struggling with the drinking, and we both depend on your job. I love you, and I can see what you've been going through. Maybe it's time to add more help to cut back on the drinking. I've been given the name of a counselor who works with professionals. He takes our insurance and has openings. What do you say we call him? How about you just go once and see if you like him? Here's his number. If you leave him a message, he'll call you back. Or another one. I hear you. You'd like to try school again. I love that you don't give up. I've seen you struggle with things, and you know what? I think your pot use is making it harder. There's a career coach who works with young people. I think maybe adding a little bit of him in might get you to your goal of going back to school. Or, so you're saying you feel anxious and depressed. You know, that makes sense to me. The Percocets and the booze can do that. Thank you for being willing to talk to me about it. You know, I think you are at a crossroads. It's time to choose how you want to live your life. If you're ready, I've figured out a couple options for getting you help. Would you be willing to sit down with me and look at what I've come up with? So ideally, you wait for a wish or a dip. The rest of the time, you avoid talk on treatment, help, or anything of that nature. Families caught up in addiction can sound like a broken record on this topic, and the loved one simply stops listening. When you do talk about treatment, make it count.